The odd maps were just locating odd sites without really taking care of the numbers of the people that we need to vaccinate, the specific age groups, and where we can find them.
At a time when COVID-19 started and we started getting vaccines, the country had no base to sort of use for planning to determine where they need to focus their allocation of resources.
So we had these big 4 facilities who were receiving vaccines. Everyone who needed to be vaccinated from the entire district had to access their vaccination in the facilities. Our target was just about 83,000.
We prepared a training material that has guidance in terms of how they'll use GRID3 maps to support their microplanning process. We gather facilities from a district, so they sit and we go through the stages, how they can use the population data that is on the map so that they can calculate target population and population within different distances. They use the population data set to find the hard to reach areas and also areas that are a bit far from the nearest health facility, so they can also be planned for, and no one is left without being provided for. We have trained 71 districts in more than 3,000 staff, health staff across the country, where they have produced more than 1,600 microplans.
The very first time when we were making a certain map for a certain facility, it was just by moving with a vehicle. You sit down and you start now coming up with your map. You would say, oh, this facility belongs here. There wasn't some special mechanism that was used to come up with those.
During the micro-planning for COVID-19 vaccination, using the GRID3 map, we were trained to specifically have maps that are covering our catchment area. Even the catchment population was calculated, and then also the settlement types were also included in that mappings. So it was even easier for us to calculate in the number of resources that were supposed to be used, including human resource. So it was easier for us.
Our experience with our training was very good because there were some things which we overlooked as a facility, but having underwent that training, we actually identified some of the hard-to-reach areas and some of the schools which were in our catchment population, especially when we came up to the mapping.
At the beginning of this year, we were somewhere around 26%. But by the end of this campaign, we were able to be at 77% in terms of the dose 1 coverage. We are only lagging on the fully immunized. I think they've been a great assistance in terms of planning and in terms of also movement. So those things, they've really been of help using the maps.